Dr. Leah, a young woman, writes, I haven't had sex for years due to depression. I am ready for sex again, but is it possible for a hymen to grow back? I'm worried about pain.
No, the hymen cannot grow back once it's been stretched or torn open. The hymen is a thin, fleshy tissue that stretches along the opening of the vagina. The hymen can be stretched the first time you have vaginal sex, but it can also be stretched or torn by a bunch of different other methods, such as using tampons, using a sex toy, riding a bicycle or a horse. And some people are born with such little hymenal tissue that they never even notice it was there to begin with. Regardless of the situation, there is nothing you can do to grow back your hymen without surgery, so don't worry about the pain. There is a procedure, however, called hymenoplasty. Other people will call it hymen restoration surgery, where a thin layer of the inner vaginal wall is cut and reattached across the vaginal opening. So it reduces the size of opening upon penetration. It will also cause tear and bleeding once somebody has penetrated again. Recovery time on this procedure is anywhere from 6 to 8 weeks. You definitely want to refrain from any sexual activity or tampon use during that recovery period. And to my knowledge, it cannot be performed if the woman has already given birth.